My name is Dr. Alex Fondaw, and I am currently a bariatric surgery fellow here at the Menorah Medical Center. I went to undergrad at University of Kansas with Dr. Ashton Dover here. I did my medical school also at the University of Kansas. I went up to Chicago at St. Joe's Hospital for my general surgery residency, and like I said, I'm a current fellow here at Menorah. And this is Dr. Ashton Dover, who I also went to college with.
My name is Ashton Dover. I'm a physical therapist and strength and conditioning coach. I also went to the University of Kansas, like Dr. Fondaw said. I did my PT schooling at Mayo Clinic up in Minnesota. I started my career in Denver, Colorado, and I just moved here this year back to Kansas City, where I'm from, my hometown.
All right. So we're here today to talk to you about prehabilitation and rehabilitation, specifically as it pertains to bariatric surgery. So bariatric surgery has a long list of benefits, obviously not just in weight loss, but it also helps with hypertension, diabetes, hyperlipidemia, as well as a lot of increased mobility, especially for patients who have osteoarthritis secondary to a long history of a lot of excess weight on your knees and back. And so we're going to talk today about benefits of prehabilitation and rehabilitation before, right in the perioperative period, and then after surgery. So as far as prehabilitation, there's things you can do to basically get yourself ready for surgery and get yourself ready for the post-surgery. So Dr. Dover, take it away.
Yeah. So there's two main groups of people that we can think about that really benefit from prehabilitation or prehab, as most of us will refer it to. The first group is people that have a long history of comorbidities, joint pain, maybe previous surgeries. Those are the people that the prehab is going to be more intensive. It might take anywhere between 4 and even up to 8 weeks. These are the people that we really want to make sure are adequately mobile before heading into surgery. Now, some people may not have as much joint pain or might not have as many, physical impairments heading in. With these people, we can still see a lot of benefit from prehab. The biggest one is being setting expectations prior to surgery, letting you know about some of the guidelines for the post-op period, showing you some of the exercises that are going to happen, that way you know how to perform them and know what they feel like prior to surgery, as well as just making sure, hey, you understand where to go, understanding if family members can be there. All of these things are really important so that when you wake up from surgery and you're going through those first 5 to 7 days, you're not adding to some of those problems that you might already be seeing.
Yeah. There's a couple different things about how to approach prehab.
Yeah. So as far as approaching prehab, we can do it in a few different ways. The most casual way of just thinking about, okay, what are the physical activity guidelines? So the CDC has some physical activity guidelines, 150 minutes of moderate exercise per week, as well as a couple days of strength training. The easiest way to go about this is a little bit of walking, and if you do have any exercises that you are familiar with, this would be a great time to just start doing those exercises casually, getting your muscles working, getting your blood pumping a little bit. Anything that you can do prior to surgery is going to be helpful overall. As far as some people that may have more specific cases, always follow your surgeon's pre-plan for you. This might be seeing a respiratory therapist prior to, this might be seeing someone like me or another medical professional, but this is really important when we consider any sort of other physical impairments or complications that may be important to the surgery. But the last thing would be, if you do feel like you need help, or if you have some impairments that you really want to have taken care of prior to, I would say this is where you want to seek out a physical therapist or another medical professional.
Yeah. So then in the perioperative period, day of surgery, we'll want you up and walking around, want you starting to drink, not necessarily jumping right into those heavy activities, but then right after surgery, the first week or so, like Dr. Dover is alluding to, we want you to be mobile as possible. We want you up and walking around. That'll help minimize complications and expedite recovery. And then as the weeks go on, we start adding in more and more exercise in. That's when we start getting in the full rehabilitation phase. Right now that you're out of acute recovery, now you're going to be rehabilitating, kind of adjusting to your new body and your new normal.
Yeah, so we definitely want to make sure we're gradually building up exercise. Early on, like Dr. Fondaw said, walk, as well as if you need help from family members to get up and down stairs, up and from a chair, don't be afraid. Use some hand support. Ask a family member. This is no time to go over the top and really hurt yourself. This is the period where, yes, we want to make sure that we're taking care of our bodies, but we do want to be as active as possible and gradually build up from there. If you are having any persistent or ongoing pain related to joint, or even if you're feeling deconditioned, again, this is a time that you want to seek a rehab professional, a physical therapist, or make sure that you address this with your surgeon at some of your follow-up appointments.
Yeah. And the thing is, like we were talking about a little earlier, is when you're doing these prehab exercises, a lot of it's to get ready for your rehab, because you don't necessarily want to start exercising and then start confusing muscle soreness for post-operative pain, because there's going to be those working things and literal, or I guess the opposite of, growing pains.
So some of the exercises that you can do at home. Some of the exercises that you can do at home. If we haven't said it more, a number of times, keep on walking. It's the simplest form of exercise, and it's always going to help. Some seated exercises that you can do at home would be like standing marches. You can work on trunk rotations. A lot of times you're going to feel some tightness as far as in your abdominal area and in your trunk. So being able to rotate and stand up nice and straight. Other exercises that you could do to work out your shoulders are some I's, Y's, and T's. So we might be talking about I's and Y's and T's. Other things that you can be doing are sitting to standing, so a basic squat, so we can stand up and nice and easy back down. And this is something that you can use hand support for. Really anything to get some blood pumping into the upper extremities, into the trunk, as well as into the legs are going to be really helpful. As far as standing exercises moving forward, again, continue to progress at your own weight, but don't be afraid to move more. Exercise, adhering to physical activity, these are all the things that are going to help better outcomes as you move forward.
Yeah. And every pound you lose is going to be less harsh on the knees, less harsh on your back. Even losing weight in the arms will be less harsh on your shoulders. So things you might not have been able to do before or weren't doing very well before, those are things you'll continue to progress through. And by doing some of these exercises in the before period and in the acute post period, as well as through your recovery, you can continue to help yourself and help your best self to recover. And as far as ways to get physical therapy more specifically involved.
Yeah. So if you are struggling with any ongoing pain, any problems with exercise, I would always recommend seeing a physical therapist or reaching out to a rehab professional. A lot of times people do have pre-existing joint pain or previous surgeries, and like it or not, this is still surgery. I mean, there's going to be some pain and discomfort associated with it, and sometimes this can make some previous pains, can turn the volume up a little bit. So this is a great time to address all of these issues and continue moving forward so that you continue to see Dr. Fondaw, tell him how well you're doing, as well as continue to feel better about these joint pains. Going along with that, we want to make sure that exercise adherence follows through. The part of some of the worst outcomes we see are when we don't adhere to the exercise plan, we fall off our routine, and that becomes pretty easy when we're not feeling so great after surgery, right? So I would always recommend adhere, walk a little bit, and make sure if you need help, please ask for it.
Yeah. And we'll put our contact info in the slides. Obviously, for Dr. Dover, you can reach him via email. He works over at Empower PT, KC, and there's a website as well where you can get in contact with him. I'll have my contact info on here as well, and I'm over there at the Metabolic and Bariatric Specialist here at Menorah Hospital. All right.
Yeah. Thank you, Dr. Fondaw. I appreciate it. Good luck to everyone on your journey, and if you need help, again, feel free to reach out. We're more than happy to help.
All right, and thank you, Dr. Dover, for taking time to educate some patients and me as well about physical therapy before and after surgery.
Absolutely.
All right.